Okay, so welcome back. All right, so break is if you go to the exclusive club, see the file section, can someone tell me where? Okay, all right. So this is as far as your, we were discussing what are the differences between a local potential and what is an action potential, right? Local potential and action potential. Now, for instance, like I said, local potentials produced by subthreshold stimuli, action potentials by threshold and suprathreshold stimuli, right? These are graded responses. Action potentials are all or none responses, right? Okay. Now, local potentials are not self-propagated. Action potentials are self-propagated. Action potentials will travel without any decrement. That means there is no decrease in the amplitude of the action potentials from one part of the neuron to the other. And local potentials, they in fact do not travel, right? They will decrease over time and space, right? See, what is a graded response, Kaustuv? Graded response means chota stimulus, chota response. Small stimulus, small response. Larger stimulus, larger response. It's graded depending upon the strength of the stimulus. Okay? Kaustuv, right? Now, then let's see. Local potentials can be depolarizing or hyperpolarizing, and action potentials are always depolarizing, right? Action potentials are always depolarizing. Local potentials, action potentials are followed by some action, and local potentials are not followed by some action, right? Then may or may not be followed by some action. Summation, spatial, and temporal. Now, what do you mean by spatial? What? Madhumita is a very long question. I can't read it. What is it? In subthreshold potential, how does the VGCH close it? Or voltage gated channels closed? Is it due to saturation or inside? Oh, we'll discuss it. Madhumita, don't worry. I still have to do what will happen to the channels. Okay, this is just the basics right now. Okay, all right. All or none का मतलब क्या है सौरभ? या तो पूरा action potential मिलेगा या नहीं मिलेगा. All, complete or none. ठीक है? Subthreshold stimulus. Okay, Madhumita, I'll just explain that to you. All right. Okay. Now, this is spatial and temporal summation. So what is spatial summation? Spatial summation is the addition or summation over space. Now, what do I mean by that? That means if I give one subthreshold stimulus, I get a local potential. Yes, if I give one subthreshold stimulus, you get a local potential. But if I give a number of subthreshold stimuli simultaneously, then all these local potentials will be added and I get an action potential. This is known as addition over space, right? Or a spatial summation. What is spatial summation? Spatial summation is when a number of subthreshold stimuli are given simultaneously, when a number of subthreshold stimuli, yes, when a number of subthreshold stimuli given simultaneously, this produces an action potential. When a number of subthreshold stimuli given simultaneously, and that produces an action potential. This is known as spatial summation. Summation, that means it is addition over space. Individually, a subthreshold stimulus can only produce a local potential. But if I give them at the same time, I can produce an action potential. Right? What is temporal summation? Temporal summation is summation over time. Temporal. If I give a subthreshold stimulus, you will get a local potential. But if I give an increased frequency of subthreshold stimuli, that means if I give subthreshold stimuli one after the other, increased frequency of subthreshold stimuli, then the local potentials that they produce, they are added and I get an action potential. Increased frequency of subthreshold stimuli produces an action potential. Spatial summation over space, number of subthreshold stimuli given simultaneously produces an action potential. Temporal is increased frequency of subthreshold stimuli produces an action potential. What are the examples of local potentials? We've already done two of these. That is going to be EPSP, excitatory postsynaptic potential, IPSP, inhibitory postsynaptic potential, then a receptor potential. Receptor potential, this is an example of a local potential, receptor potential, then motor end plate potential. Motor end plate potential, this is also an example of a local potential. Motor end plate potential, right? These are examples, these are different types of local potentials that you can see over here, right? EPSP, IPSP, and receptor potential at the level of receptors. Also, the responses are graded depending upon the strength of stimulus, right? Motor end plate potential, this is at the neuromuscular junction. Now, let's have a little detailed look at EPSP and the IPSP. EPSP and IPSP, inhibitory postsynaptic potential as well as excitatory postsynaptic potential. Excitatory postsynaptic potential and an inhibitory postsynaptic potential. Now, what is excitatory? This is a depolarizing local potential. This is a depolarizing local potential. That means the potential becomes less negative here. IPSP is a hyperpolarizing local potential, right? This is a hyperpolarizing local potential. That means here the potential becomes more negative, right? Now, how do you get an EPSP? Now, EPSP will be seen once the cell gains positive charge, right? Once the cell gains positive charge, you will be able to see an EPSP, right? If the cell gains positive charge, you get an EPSP. How do you get an EPSP? EPSP is if there is increase in sodium influx. If there is increase in sodium influx, sodium comes from outside to inside, cell gains positive charge, potential will become less negative. Or if there is a calcium influx, calcium will come from outside to inside, inside will gain positive charge, depolarizing local potential. Or if there is a decrease in potassium efflux, right? Decrease in potassium efflux. See, what do I mean by that? We've already discussed some leak channels, isn't it? You know that there are some leak channels for potassium which are open at rest. And through these channels, there is an efflux of potassium. There is an outward movement of potassium. And that is what is responsible for the resting membrane potential. We've discussed that, isn't it? The leak channels for potassium, which are open at rest, and because of this, like I said, there is going to be loss of potassium, so potassium goes from inside to out. Now, supposing by some mechanism, if I close some of these leak channels, what will happen to intracellular potassium? Increases. Positive charge increases inside the cell. And if positive charge increases inside the cell, the potential of the cell will become less negative. This is what is known as a decrease in potassium efflux. As a result of all of these, either an increased sodium influx, increased calcium influx, or a decreased potassium efflux, there is a net gain of positive charge. And net gain of positive charge means that the potential of the cell will go from more negative to less negative. Okay? So this is as far as your EPSP IPSP is concerned. How do I get an IPSP? IPSP this is possible. That means the cell, it has to become more negative. There is an increased chloride influx, opening of chloride channels, so gain of negative charge, or if there is an increase in the potassium efflux. Right? More potassium channels open up, there is more loss of potassium, and the potential will become more negative. That is an IPSP, hyperpolarizing local potential. Right? So this is an EPSP and the IPSP. Right? EPSP and IPSP. Right? This is as far as your local potentials and action potentials are concerned. Now, this has been asked as a neat question. Which of the following mechanism will produce an IPSP? And the answer was increase in chloride influx. The options were increase in potassium influx, calcium influx, sodium influx, all that. And the answer was increase in chloride influx. Right. Snehal Borana, potassium chloride efflux is not possible. Remember, what did I tell you? An ion can only move from higher to lower concentration through a channel. You cannot get a chloride efflux. Chloride is always an influx. Is that true? Is that clear? Snehal Borana, I hope you've understood that, right? Okay. Now, this is as far as your local potentials are concerned. Next, let's have a look at what is the ionic basis of the action potential, right? What is the ionic basis of the action potential? Let's try and see that. Ionic basis of the action potential. How does an action potential result? Now, we've already discussed that the resting membrane potential of most neurons Prananka, what will happen if the potassium channels are blocked? There will be less efflux of potassium from inside to outside. So inside positive charge will increase. And if inside positive charge increases, you will get an EPSP. Right? Prananka, you've asked me this. Supposing a decrease in potassium efflux, there will be gain of positive charge. So EPSP. Okay? Misbah Inamdar, please have a look. What are summations, spatial and temporal? Spatial means addition over space, summation over space. Temporal is summation over time, right? So Shreya, in IPSP, either there is going to be IPSP either by, there is either gain of negative charge, there is either gain of negative charge or more loss of or increased loss of positive charge. Either way, the potential of the cell will become more negative. Okay? More negative. All right. Okay. Now, the next thing which I wanted to discuss with you was the ionic basis of the action potential. Now, as far as ionic basis of the action potential is concerned, like we've already discussed, that the resting membrane potential in the case of majority of the neurons is -70. Now, when I give a threshold stimulus, I'm opening voltage-gated sodium channels, influx of sodium. Potential of the cell changes from -70 and it goes up to -55. We've already discussed -55 is nothing but the threshold potential. Once it reaches -55, now the opening of sodium channels is by a positive feedback mechanism. So what happens is influx of sodium causes opening of more sodium channels, more influx of sodium, opening of more sodium channels. The potential now goes right up to 0 and up to 30 millivolts. This is the depolarization phase of the action potential. This is opening of voltage-gated sodium channels and because of a sodium influx. Right? Now, once it reaches plus 30 millivolts, now starts the repolarization phase. Next, you have the repolarization phase of the action potential. What is repolarization phase of the action potential due to? This is due to closure of sodium and opening of potassium channels. So the repolarization phase is due to a decrease in the sodium influx and an increase in the potassium efflux. Right? So there is closure of sodium and opening of potassium channels. This is responsible for the repolarization phase. Depolarization was because of opening of voltage-gated sodium channels, increased sodium influx. Repolarization is because of closure of sodium and opening of potassium channels. Now, let's look at another phase. There is something known as the hyperpolarization phase. This is the hyperpolarization phase. And what is this hyperpolarization phase of the action potential due to? Now, during this phase, the potential is minus 71 to minus 72 millivolts, 1 to 2 millivolts more negative than the resting membrane potential. Hyperpolarization phase, during this phase of action potential, the potential is minus 1 to minus 2 millivolts more negative than the resting membrane potential. That means the potential is about minus 71 to minus 72 millivolts. This is another phase here. This is what is known as the after depolarization phase. This is the after depolarization phase. Yes, this is known as the after depolarization phase. And what is this after depolarization phase? After depolarization phase, now what happens in the after depolarization? Please remember, though it is happening after the repolarization phase, but the name is after depolarization phase. Right? There is nothing wrong with the term here. This is after depolarization phase. Now, what is this after depolarization phase due to? See, I've just discussed with you that voltage repolarization is because of voltage-gated potassium channels. Right? Potassium tends to move from inside to out. Yes, this is repolarization. So what happens is, the potassium, as it is moving out of the cell, it tends to stand around the mouth of the channel. Right? Potassium is more inside the cell. It tends to move as the potassium channels open. It tends to go out, but it stands around the mouth of the channel. So what happens is, there is now a decrease in rate of, there is a decrease in the rate of potassium efflux during this phase. I've always told you. It's like if when we are leaving the lecture hall, right? Pre-lockdown period, whenever you left the lecture hall, when you move out of the hall, and if some of you go and stand around the door, so what will happen to the rate of efflux? People trying to come out of the hall, what will happen to that rate? Reduces. And that's exactly what is happening during this phase. There is a decrease in the rate of potassium efflux simply because potassium is standing around the mouth of the channel. Right? So this gives rise to the after depolarization phase, there is a slight curve. It's a slope. It's not a straight change in potential. There is a slight curve which happens because of a decrease in the rate of the potassium efflux. Okay. Now, to understand the depolarization and the repolarization phases, I will now discuss what are the differences between sodium channels and potassium channels. Right? So let us try and understand voltage. What are the differences between the voltage gated sodium channels, yes, and voltage gated potassium channels? Let's try and understand the differences between the voltage gated sodium channels and the voltage gated potassium channels. Right? Now, the first important difference between voltage gated sodium and potassium channels, these are potassium efflux or Ashley George, how can there be an influx of potassium, beta? Potassium will always move from inside to outside the cell. I've been repeating that so many times, that movement of an ion is always from higher to lower concentration. The name is after depolarization, even though Mubina Sultana, even though it is happening after the repolarization phase, there is no problem, in no error here. The name is after depolarization. तानिया रॉय, permeability का मतलब ये है कि leak channel खुला है. This also has been explained to you earlier. Permeability का मतलब यही है that there are leak channels which are open, right? Okay, Shilpa Chandran. Yes, the moment a stimulus causes the change in potential to minus 55, after that you will get an action potential. A stimulus which does not take the potential to minus 55 is sub-threshold stimulus. Shilpa Chandra. Okay. Okay. So voltage-gated sodium and voltage-gated potassium channels. Now, what are these voltage-gated sodium and potassium channels? I am telling you the reason for the different phases. I have not completed this topic. Why are you asking me what is... क्यों बेटा, क्यों परेशान कर रहे हो? कोई इंपॉर्टेंट क्वेश्चन है, कुछ नहीं, वो तो पूछो, लेकिन ऑलराइट. ओके. Voltage gated sodium and voltage gated potassium channels. Voltage gated sodium channels, these are fast channels. Voltage gated potassium channels are slow channels. Voltage gated sodium channels are fast channels. Voltage gated potassium channels are slow channels. Remember, when I say fast channels, these are fast to open and they are fast to close. They are fast to open as well as fast to close. These are voltage gated. So whenever there is a change in voltage, it will cause the opening of these channels, and these are not just fast to open, they are also fast to close. The voltage gated potassium channels, these are slow channels. That means these are slow to open and slow to close. Yes. Now, all of you who were getting restless, what is the hyperpolarization phase due to? Now listen to this. What is hyperpolarization phase due to? This is now due to a slow closure. This is due to a slow closure of the slow potassium channel. As long as the potassium channel is open, there is going to be movement of potassium from inside to outside the cell, so that the potential of the cell becomes slightly more negative. Because there is a slow closure, there is more loss of potassium, so potential is 1 to 2 millivolts more negative than the resting membrane potential. Now, the next important point is, now these are both voltage gated. Voltage gated means they open in response to a change in voltage. Now my next point is, at what voltage does the sodium channel open and at what voltage does the potassium channel open? The sodium channel, it opens in a voltage range of, minus 70 to plus 30 millivolts, right? Minus 70 to plus 30 millivolts. And surprisingly, the range for opening of the voltage gated potassium channel is also minus 70 to plus 30 millivolts. The range for the opening of the range for the opening of the range for the opening of voltage gated sodium and voltage gated potassium channel is going to be the same, minus 70 to plus 30. That means to open the potassium channel, I do not need a second stimulus. One stimulus will take care of both sodium and potassium. But which channel will open first because it is a fast channel? Sodium. So that is why the first phase is a sodium influx resulting in depolarization. This is followed by repolarization. What is repolarization due to? Closure of sodium. Why did I say closure of sodium? Because sodium channel is a fast channel, fast to open, fast to close, right? So closure of sodium and opening of potassium, slow opening of potassium channels is responsible for the repolarization phase. By the time potassium channels, remember, are slow channels. By the time potassium channels start opening, sodium have already started closing. Sodium channels are fast channels, fast to open, fast to close. Voltage range for the opening of sodium and potassium is the same. One stimulus will act on both sodium and potassium, but sodium channels will open first because they are fast channel, and potassium channels will open later because they are slow channels. So repolarization is because of closure of sodium and opening of potassium. Now, another important point is when you look at the sodium channel has got two gates. It's a double gate channel. There is a gate towards the ECF and one towards the ICF, right? The gate towards the ECF is called the activation gate. This is called the activation gate. Towards the inside is called the inactivation gate. Inactivation gate. This is in fact a ball and chain mechanism. This is a ball and chain mechanism. Ball and chain mechanism. Right? Now, here in the activation and the inactivation gate, whereas in the case of a potassium channel, there is only a single gate which is towards the outside. Right? This is towards the outside. This is in the case of the potassium channel. Right? Potassium channel. So a sodium channel has got two gates. There is an activation gate and an inactivation gate. Potassium channel has got only a single gate which is towards the outside. Now let's see the next thing. Next is, let us see what will happen to the sodium channel in these different phases. Right? What will happen to the sodium channel in these different phases? Let's try and see that. Now, sodium channel at rest. When the cell is at rest, the sodium channel, this is ECF, this is ICF. The activation gate is closed, but the inactivation gate is open. This is called the resting state. Inactivation gate is open, but the activation gate is closed. If the activation gate is closed, right? If the activation gate is closed, there is going to be no influx of sodium. Sodium cannot, one of the gates is closed, there can be no influx of sodium. This is called the resting state. This is when the cell is at rest. There is no movement of sodium, no influx of sodium. Remember, these are voltage gated channels. When you give a stimulus, Now, the activation gate opens up. Right? The activation gate will open up. Inactivation was already open, so there is going to be an influx of sodium. This is known as the activated state of the sodium channel. So from resting state, it goes to the activated state. What is activated state? Activated state, that means opening of the activation gate and influx of sodium. Now remember, these are fast channels. Fast to open, fast to close. Now, which is the first gate which will close? The first gate which will close is the inactivation gate. This is known as the inactivated state of a sodium channel. Inactivation gate is closed, so obviously if the inactivation gate is closed, there can be no influx of sodium. Inactivation, the first gate to close. Neat question. Which is the first gate to close for a sodium channel? It is the inactivation gate. Stops the sodium influx, right? Stops the sodium influx. Then let's see. Now, please remember, when the sodium channel is in the inactivated state, you cannot open the sodium channel again. If you want to open the sodium channel again, the sodium channel must go back into its resting state. And how does it go back? What is the resting state? Resting state is the inactivation gate is open and the activation gate is closed. This is known as the resting state, right? Resting state. Inactivation gate is open and the activation gate is closed, right? This is known as the resting state, right? So this is your this is as far as your configuration of the sodium channel in different states is concerned. Let's see this once again. Resting state, inactivation gate is open, activation is closed, no influx. Give a stimulus, opening of the activation gate, what is known as the activated state, sodium influx. First gate to close is the inactivation gate, which is known as the inactivated state. And in an inactivated state, you cannot open the sodium channel again. To open the sodium channel again, there has to be a change in configuration. From the inactivated state, it has to go back to the resting state. And that will cause, then only you can give another stimulus and produce another response. All right. Now let me see your questions. Yes, Vani, action potential occurs due to efflux of potassium through voltage gated, not through leak channels. Absolutely right. Leak channels are for rest membrane potential. They are voltage gated. They will open in response to change in voltage. Now, how does it go from inactivated to resting state? As the potential of the cell approaches the resting membrane, there is a change in configuration of the sodium channel and it goes into resting state. As the potential approaches, as the potential of the neuron, as potential approaches the resting membrane potential, as potential approaches resting membrane potential, there is a change in the configuration. There is a change in configuration of the sodium channel, and that goes from, there is a change in configuration of the sodium channel, and that goes from the inactivated to the resting state. Okay? Second. Ankur Sarkar, why the opening is not from minus 55? So minus 70 से minus 55 कैसे जाएगा? Ankur, it has to go from minus 70 to minus 55. That has to be due to opening of sodium channels. Once it reaches minus 55, now the opening of sodium channels is by positive feedback mechanism. Okay. So this is as far as the sodium channels in different phases of the action potential are concerned. Potassium, again gained in the cell in the consequent ATP. What does that mean? G. Karthik, what are you saying? Obviously, repolarization phase is because of opening of potassium channels as well. Okay? All right. Okay. क्या है? युविका, last picture में क्या है? Right. Again, right. Okay. Now, this is as far as these sodium channels in different phases are concerned. Please remember, repolarization is because of closure of sodium and opening of potassium. Potassium channels are slow channels, slow to open and slow to close. And because they are slow to close, it results in the hyperpolarization phase. As long as the potassium channel is open, there is going to be loss of potassium. Okay? Slow closure. Longest phase, Avantika, is the hyperpolarization phase. You can see that, right? Hyperpolarization phase. Of course, there is opening of Dr. Strange. Why a strange question? पोटेशियम चैनल है तो सही, ये पोटेशियम इफ्लक्स किसमें हो, किसके थ्रू होगा? पोटेशियम चैनल के थ्रू. ठीक है? ओके. All right. Now, the next important point is, what do you understand by refractory period? Let's try and see what is refractory period. Sorry. What is the refractory period? Now, refractory period means that a cell does not respond to a second stimulus. Right? Refractory period means the cell does not respond to a second stimulus, and refractory period can be divided into two, and this is an absolute refractory period, and there is a relative refractory period. Right? Absolute refractory period and a relative refractory period. Absolute refractory period means there is absolutely no response, irrespective of the strength of stimulus, no response. In an absolute refractory period, there is no response, irrespective of the strength of stimulus, right? Irrespective of strength of stimulus. And what is the relative refractory refractory period? That means if I increase the strength of stimulus, I can get a response. If I increase the strength of stimulus, you will get a response. Response means action potential. Yes, this is absolutely no question of action potential, and relative refractory period, increase the strength of stimulus, you will get a response. Absolute refractory period is from the firing level till repolarization is 1/3 complete. From the firing level till the repolarization is 1/3 complete. And what is the relative refractory period? This is from repolarization 1/3 complete, from repolarization 1/3 complete till the start of after depolarization phase, till the start of after depolarization phase. Absolute refractory period from firing level till repolarization is 1/3 complete. Relative refractory period from repolarization 1/3 complete till the start of after depolarization phase. Let's see this over here. Let's see this on the graph. Yes. Now I said absolute refractory period is from the depolarization, from the firing level till repolarization is 1/3. So from this point till repolarization is 1/3 complete. This is your absolute refractory period. Absolute refractory period. That means during this time, if I give another stimulus, I will not get a second action potential. I've understood. During this period of the action potential, if I give another stimulus, I will not get a second action potential. And it is not very difficult to understand, because during this period, either the sodium channels are open and the ones which have closed are in their inactivated state. And when the sodium channel is in its inactivated state, I cannot open the sodium channel again. Right? What is relative refractory period? Relative refractory period is probably this. This is from the repolarization 1/3 complete till the start of after depolarization phase. During this phase, if I increase the strength of stimulus, I can get a response, right? If I increase the strength of stimulus, I can get a response. Right? This is because some sodium channels have already gone back to their resting state during this phase. Right? So this is as far as your absolute and relative refractory period is concerned. Now, herein comes an important question. RP क्या है? RRP, relative refractory period. ARP, absolute refractory period. Okay. Now here comes an important question, and that said, a neuron is neuron. This was an important question. This says a neuron is least responsive in which phase? Least responsive to a second stimulus in which phase? Least responsive to a second stimulus. To a second stimulus. In which phase of the action potential? A, is it going to be the depolarization phase? Is it the repolarization phase? Is it the after depolarization phase? Or is it going to be the hyperpolarization phase of the action potential? Bolo. This is going to be which phase of the action potential? This is going to be the depolarization phase. Because depolarization phase falls in the absolute refractory period. Depolarization phase falls in the absolute refractory period, isn't it? We've discussed this already. -70 resting membrane potential, it reaches -55. This is the action potential here. Somebody said, please draw it on a separate graph. Let's try and see this. So the absolute refractory period was from the firing level till the repolarization is 1/3 complete. So from this point till repolarization 1/3 complete. That means the complete depolarization phase falls in the absolute refractory period. During this time, if I give a second stimulus, I will not get a response. Then relative refractory period is from repolarization 1/3 complete till the start of after depolarization. What happens in the hyperpolarization phase? Excitability is slightly less. Excitability is slightly less than at resting membrane potential. Not difficult to understand, because now in the hyperpolarization phase, the potential is -71 to -72 millivolts. That means to change the potential from -71 to -72 and take it to -55, I need a stronger stimulus. So excitability is slightly less than at RMP. Right? In the after depolarization phase, excitability is slightly more. Excitability is slightly more than at RMP, because what happens in the, if you look at this, if this is the resting membrane potential here, right? Hyperpolarization phase, the potential is is more negative, but in the after depolarization phase, the potential is less negative. So after depolarization, excitability is slightly more, and hyperpolarization, excitability is slightly less. Now let me try and see your questions. Refractory period, Jennifer, means stimulus, no response. Absolute refractory period, absolutely no response. Relative refractory period, increase the strength of stimulus, you will get a response. Yes, least responsive here means zero response. Zero response will become least. That is absolute refractory period. Okay? Okay. Okay. This is as far as your absolute refractory period, like I said, no response, irrespective of strength of stimulus. Relative refractory period, increase the strength of stimulus, it will produce an action potential. Yes? See, action potential will occur in the relative refractory period if I increase the strength of stimulus. See, what will cause an action potential? Opening of sodium channels. If sodium channels have gone from inactivated to resting state, at least if some sodium channels have gone, I can generate an action potential. Have you understood? Right? So this is as far as your. Okay? I am Groot. There are no phases of potassium channels. That is why I'm not teaching you. Potassium channels open, close. Slow to open, slow to close. That's about it. Okay? Depolarization phase of the action potential. J. Allen David Xavier, it starts from the firing level. Depolarization of the action potential. Right? But even when the change in potential is from minus 70 to minus 55, that is also a depolarization. But phase of the action potential is from the firing level. Because if the potential does not change to firing level, you don't get an action potential. Okay? Okay. There is no role of leaky channel in action potential. Kuldeep, leaky channel is resting membrane potential. Voltage gated channels are action potential. लीकी चैनल मैंने लिखवाया था कुलदीप कि वो रेस्ट पे खुलते हैं, ठीक है. वोल्टेज गेटेड चैनल तब खुलेंगे जब आप स्टिमुलस देंगे, जब चेंज इन वोल्टेज होगा. कुलदीप त्यागी, ये हम कर चुके हैं बेटा, आप अपने नोट्स देखिए. ऑलराइट. Strength of stimulus is simply quantified on the basis of the potential change. If a stimulus is able to change the potential from minus 70 to minus 55 is threshold. If it is not able to change it, take the potential to minus 55, it is sub-threshold. Okay. Maximum in hyperpolarization, who told you that, K. Sanjana? Have I said that? Hyperpolarization phase, the excitability is less than RMP. It is even lesser excitable as compared to resting membrane potential. Okay? All right. Okay. Now, this is as far as your absolute refractory period. Now, the next important topic that we are going to discuss as far as this is concerned is what is the membrane conductance? What is the membrane conductance of sodium and potassium? Membrane conductance of sodium and potassium during different phases of the action potential. Please understand, we are now discussing membrane conductance. Yes, membrane conductance. When I say membrane conductance, this basically means how much of Now, membrane conductance of sodium and potassium, right? Now, now somebody was asking me over here. Membrane conductance of sodium and potassium during different phases of the action potential. Now, please understand what am I discussing here is conductance. Conductance means how many ions are passing through the cell membrane at a given point of time. Now, when I discuss the membrane conductance for sodium, the membrane conductance for sodium at rest is almost zero. We've discussed this a number of times. This impermeable to sodium, right? So membrane conductance for sodium at rest is almost zero, right? Then when I give a stimulus, there is opening of voltage gated sodium channels. Voltage gated sodium channels, if they open up, that means there is now going to be, if I open up these voltage gated sodium channels, there is going to be influx of sodium. So what is going to happen to the membrane conductance for sodium? Increases. Membrane conductance increases for sodium. And please remember, because of increased conductance for sodium, there is going to be gain of positive charge. There is a change in potential. I'm not showing you the action potential here. I'm showing you the changes in membrane conductance. When I give a stimulus, there is opening of voltage-gated sodium channels, there is influx of sodium, and because of influx of sodium, there is going to be a change in potential. We'll discuss the change in potential later. Right now, we are doing the membrane. We are doing the changes in membrane conductance. So first, there is a slow increase in membrane conductance. Then because of this change in membrane conductance, there is a change in potential. And as soon as the potential reaches -55, opening of sodium channels is by positive feedback. So now there is going to be a still larger increase, a very large increase in the membrane conductance for sodium. Now these sodium channels are fast channels, fast to open, fast to close. They begin to close. Now, as they begin to close, the membrane conductance for sodium decreases till it reaches the resting state where there is zero conductance for sodium. This is the graph for the membrane conductance for sodium. Please understand, as a result of changes in conductance, there is going to be a change in potential. Changes in membrane conductance for sodium will result in a change in potential. Now, let's see what is going to be the graph for changes in membrane conductance for potassium. At rest, the membrane conductance for potassium is much higher than for sodium, isn't it? We know that. At rest, there are leak channels for potassium which are open. So there is a higher conductance, much higher conductance for potassium at rest. And because of this high membrane conductance for potassium at rest, there is a resting membrane potential which is generated. We have discussed that. Okay? Now, when I give a stimulus, now there is going to be a slow opening of the potassium channels. Slow opening of the potassium channels. Remember, these channels are slow to open. Slow opening of the potassium channels, and these channels are slow to close. So this is going to be the membrane conductance for potassium. Please try and understand this. Much higher conductance for potassium at rest because of leak channels, open at rest. When I give a stimulus, there is opening of slow voltage-gated potassium channels, increased conductance of potassium, slow closure, and then a much slower closure of the potassium channels. Right? Now, remember, as a result of this is not a potential graph. This is a membrane conductance graph. Basic point. This is your membrane conductance graph, not a potential change graph. Please understand, because of changes in conductance, there will be changes in potential, which I will superimpose here. Madhu? Okay, I'll just answer that. Mohit? Why from 0? Because 0 Aisha Shrestha, membrane conductance for sodium at rest is 0. This is not an action potential graph. This is a membrane conductance graph. Okay? All right. Now, please remember, as a result of changes in conductance, there is going to be a change in potential. So now what I'll do is, I'm going to superimpose the action potential here. When I superimpose the action potential, because please remember, on the y-axis, we have conductance. So I cannot have potential also on the y-axis. Make sense now? Graph, you can't have two variables on the y-axis. Okay? But what I'll do is, I will superimpose the action potential here. When I superimpose the action potential, see, I'm making it in a dashed line. I'm not showing you. This is the potential change, right? This is the potential change. Resting membrane potential of minus 70, it goes right up to plus 30 millivolts. Right? It goes up to plus 30 millivolts. It crosses 0, goes up to plus 30 millivolts, and then back to minus 70. This is your all right. So this is as far as your Harshita. Again, please understand. On the y-axis, I have here in this graph, on the y-axis, we've got membrane conductance. Time is on the x-axis. Y-axis is membrane conductance. So conductance cannot go below 0. Conductance for potassium cannot go below the resting state. Changes in conductance will result in changes in membrane conductance. Changes in membrane conductance for sodium and potassium. For sodium and potassium cause a change in potential. Cause a change in potential, which is known as, which is action potential, right? Please remember, so action potential I have simply superimposed here. Have you understood? I've superimposed this here. Okay? You've got changes in membrane conductance for sodium and potassium will result in changes in potential, which I have shown you over here as an action potential. Right? Now, this is as far as your change membrane conductance for sodium and potassium is concerned. Right? And I'm going to discuss this with the help of a question here. Now the question says, now this is the question here. Neurophysiologists are studying the recordings of the membrane potential from a giant squid axon. A portion of the recordings is shown. The membrane conductance for sodium is maximum at which of the following points, or which of the following points will coincide with which point on the action potential, right? Please remember, we've just discussed this here, and we've discussed it that, so that means these 4 points which I just showed you, this is point A, this is point B, this is point C, and this is point D. So which, or 1, 2, 3, 4, which point will coincide with maximum sodium conductance? That will be point 3 or point C. Have you understood? Point D, right? Let's see. So first question, which point on the action potential coincides with maximum conductance for sodium? This was a question which was asked. Maximum conductance for sodium, and your answer is C, isn't it? Next question. Which point on the action potential, coincides with maximum conductance for potassium? Which coincides with maximum conductance for potassium? A, B, C, or D? Bolo, which coincides with maximum conductance for potassium? Potassium maximum conductance will coincide with point D. This is going to be the maximum conductance for potassium. This will be point D. The point on the action potential will coincide with maximum conductance for sodium is point C. The point on the action potential which coincides with maximum conductance for potassium will be at point D. Next question. Which point on the action potential is close to the equilibrium potential for potassium? Which point on the action potential is close to the equilibrium potential of potassium? Please remember, what is the equilibrium potential? I forgot to give you these values. Please add them somewhere. Equilibrium potential, that is the Nernst potential for potassium, is minus 90 millivolts. Equilibrium potential for chloride is minus 70 millivolts. Equilibrium potential for sodium is plus 61 millivolts. Equilibrium potential for calcium is plus 125 millivolts. Just make a note of this somewhere. These are the Nernst potential for different ions, and we've already discussed equilibrium potential or Nernst potential is calculated when the membrane is freely permeable to that ion. Right? So my next question is, at which point on the action potential is close to equilibrium potential of potassium? Remember, equilibrium potential of potassium is minus 90. Which point will be closest to minus 90? A, B, C, or D? A. A is closest to minus 90. So which point on the action potential is closest to equilibrium potential of potassium? A. Which point on the action potential is closest to equilibrium potential for sodium? Equilibrium potential for sodium is plus 61. Which point on the action potential is closest to plus 61? Closest to plus 61 will be point C. Point C is at plus 30, which is closest to plus 61. So this is going to be plus 61 millivolts, which is point C. These are four extremely important questions. Which point on the action potential coincides with maximum conductance sodium? C. Maximum conductance for potassium? D. Closest to equilibrium potential of potassium? A. Closest to equilibrium potential of sodium is C. Right? What are the equilibrium potentials for normal values? Equilibrium potential for potassium is minus 90, for chloride is minus 70, for sodium is plus 61, calcium is plus 125. Yes? Okay. Now, Indu Darsani, have I given E? I've not given E now. Okay. So now, please try and understand. Point C is coinciding with the maximum conductance for sodium. Point D is coinciding with maximum conductance for potassium. Now, if I had given you a point E over here, hyperpolarization phase. So the potential which will be closest to the point which will be closest to the equilibrium potential of potassium will now become E, like somebody had asked me. Okay? Right? So this is going to be the all right. Any doubts as far as this is concerned, as far as these four questions are concerned? Okay. In relative, if we give a higher stimulus, then an action potential. Naman, yes, absolutely right. Okay. I've shown you the normal values. Anything else here? Anything else? Okay. Now, when I said which point on the action potential coincides with equilibrium potential of sodium, we said C. C is closest to plus 61, right? Now, to understand this conceptually also is not very difficult. See, I've discussed with you what happens in Nernst potential. When you talk of a Nernst potential, when the cell membrane is freely permeable to that ion. Okay? Now, at rest, the cell membrane is impermeable to sodium. Now, when I give a stimulus, I'm opening voltage-gated sodium channels. So what is happening to the cell membrane permeability for sodium? Increases. Yes, the cell membrane which was impermeable to sodium at rest has now become freely permeable to sodium. There is opening of sodium channels and the membrane has become freely permeable to sodium. So sodium rushes from outside to inside. And this movement of sodium from outside to inside, and remember, everything tries to reach its state of equilibrium. Sodium will come from outside to inside, try to reach its equilibrium potential of plus 61 millivolts. But the only reason why it can't do so is it stops at plus 30 is because sodium channels are fast channels, fast to open, fast to close. They have begun to close. This is the significance of the Nernst potential. At rest, cell membrane almost freely permeable to potassium. So the potential at rest is close to equilibrium potential of potassium. When I give a stimulus, I'm opening sodium channels. I'm making the membrane more permeable to sodium. So influx of sodium will try to reach its equilibrium potential of plus 61. The fact is it cannot because sodium channels are fast channels and they begin to close. Now tell me, have you all understood this? Okay. Debashish Nanda from minus 70 to minus 55 is through voltage gated sodium. There are no leaky sodium, please understand, or they're very minimum. Okay. Hyperpolarization phase is because of slow closure of the potassium channels. Okay? See, you must understand why the peak of sodium is less than the peak of why the peak of potassium is less than, because there are two different channels, two different ions, isn't it? So why would the peaks be the same? Isn't it? All right. Why should it? Because there are two different channels, two different. So it is showing you the increase in conductance from the basal level. Okay, now. Okay. I said if you get a question, if E was given, then your answer, point on the action potential which is closest to equilibrium potential of potassium, then your answer would have been E. E would have been your answer then if E was given. Somebody was asking me if E is given, then what is going to be your answer? Then your answer would have been E, right? A or E. If E is not there, then A. But if E is given, then your better answer is E. Okay? Okay. Normally options तो चार ही होते हैं ना. So A, B, C or D, then your answer is A. But if E was given, then E. Okay. मैक्सिमम कंडक्टेंस वाई नॉट बी. कहां बी है बेटा कंडक्टेंस? कंडक्टेंस का ग्राफ देखिए, नीला वाला ग्राफ देखिए, उसका पीक कहां है? बी पर है कि सी पर है? कौन सा पॉइंट कोइंसाइड कर रहा है? कंडक्टेंस वाला ग्राफ ब्लू में सोडियम का है, पिंक में पोटेशियम का है. किस पॉइंट पर सोडियम का कंडक्टेंस सबसे ज्यादा है? सी के पास. किस पॉइंट पर पोटेशियम का कंडक्टेंस सबसे ज्यादा है? डी पर. ये तो स्ट्रेट फॉरवर्ड ग्राफ है ना. इज इट क्लियर? राइट. Conductance. Okay, chalo, I can't spend more time on this. Okay, begging you to continue. Oh, okay. Even I'm begging you not to type messages, inane messages. All right. Okay. So let's go on to the next thing. Next is what are the what is the site of generation of an action potential? Right? What is the site of generation of an action potential? Site of generation of an action potential. Right? Acha, one more point before I go on any further is please remember that ionic changes. I've already told you this earlier in the day, and I'm re-emphasizing this. Ionic changes during an action potential are minimal, very small change. Just a few sodium ions will come from outside to inside, resulting in a change in potential. And similarly, repolarization phase, just a few potassium ions will go from inside to outside. Remember, ionic changes are very small. They do not produce a change in concentration. Please keep that in mind. There is no change in concentration of ions during the action potential. I remember when I was a UG, I used to think that during the depolarization phase, so much sodium comes from outside to inside that there is a hyponatremia. During repolarization, so much potassium goes from inside to outside, there is a hyperkalemia. No, that concept is completely incorrect. Ionic changes are very small, very small, not sufficient to produce any change in action potential and any change in concentration. So please remember, during an action potential, ionic changes are very small. Ionic changes are very small. That is insufficient to produce any change. These are insufficient to produce a change in concentration. I've already discussed that with you, right? Insufficient to produce a change in concentration. After a few thousand ions, after a few thousand action potentials, right? After a few thousand action potentials, there is going to be an imbalance. You have more sodium imbalance will be there. There'll be more sodium, slightly more sodium inside the cell, slightly more potassium outside the cell. Imbalance is going to be corrected by the sodium potassium ATPase. Sodium potassium ATPase will pump the sodium out of the cell, bring the potassium into the cell. But please remember, the role of the sodium potassium pump is not after each action potential, it is after a few thousand action potentials, right? Few thousand action potentials. Right, so this is what happens during an action potential. Ionic changes are very small, which are insufficient to produce any sort of a change in concentration. But after a few thousand action potentials, the imbalance is going to be corrected by the sodium potassium ATPase pump. Okay? All right. Site of generation of an action potential. Now, if you look at an action potential, if you look at a neuron, Rose, please, a request to you. We are going as per schedule. Whatever schedule I have in my mind, we are going exactly as per that. So please do not think that we are going too slow or too fast. It's not. Do not bother yourself with that. We have promised that physiology will be completed in 4 days. It will be completed in 4 days. right? So please do not distract me by saying that this is too fast, too slow. It's not going to help either of us. This is a time bound thing that we are doing for you. No point in discussing how long is it going to take. Yes, these are difficult concepts. Most of us have not done them well in UG, but these are half of the questions come from first 3 chapters, which I'm going to do with you. This is the second chapter, which I'm doing with you. Half of your questions in the NEET exam, in most of the exams, come from these first 3 chapters. That is why we are spending time. That is why we are trying to learn the concepts. And so do not bother yourself and do not trouble me as well. When is it going to finish? 4 days are going to be less, 6 days are going to be less. It doesn't matter. It has to, when we have told you it is going to be finished in 4 days, it will be finished in 4 days. All right. Now next, let's see. There is this is what is known as the soma-dendritic zone. Soma-dendritic zone. Soma-dendritic zone is a zone of graded electrogenesis. This is soma-dendritic zone is a zone of graded responses. This is a zone of graded electrogenesis. And this has been asked as a question. This was a NEET question which was asked. Where do you get graded responses? Graded responses are local potentials. Soma-dendritic zone is a zone of graded responses, graded electrogenesis. Now, let us see the questions which have come from this particular topic, and let's see that. The first question says, in a spinal motor neuron, the site of generation of an action potential is, what is the site of generation of an action potential? In a spinal motor neuron, what is the site of generation of an action potential? Is it going to be the dendrites? In a spinal motor neuron, is it going to be the dendrites? Is it going to be the soma? Is it going to be the axon hillock? Or is it going to be the axon? Right? So let us try and see what is the axon hillock. Axon hillock is the dilated part of the cell body from where the axon arises, right? This is axon hillock. This is the dilated part of the cell body from where the axon arises. This is continuous as what is known as the initial segment. And what is this initial segment? Initial segment is the initial unmyelinated part of the neuron. This is the initial unmyelinated part of the axon. That is known as the initial segment, right? Axon hillock and initial segment. What is the important point about the axon hillock and the initial segment? These areas have a very high concentration of sodium channels. They have a very high concentration of sodium channels, right? These two areas, that is the axon hillock and the initial segment, they have a very high concentration of sodium channels. So the question is, in a spinal motor neuron, SP is spinal motor neuron, the site of generation of an action potential will be the axon hillock. Yes. Why axon hillock? Because axon hillock has a very high concentration of sodium channels per unit area. Right? Now the same question was asked, but now the options were changed. Yes. The options now were A, dendrites, B, soma, C, axon hillock, or D, the initial segment. Now, if axon hillock and initial segment are given, then your answer becomes the initial segment. Out of the two, axon hillock or the initial segment, segment, it is the initial segment which has got a higher concentration of sodium channels, right? So this is in spinal motor neuron, the site of generation of an action potential is going to be axon hillock. And if initial segment is given, if both are given, axon hillock and initial segment, better answer is initial segment. Now the next question is, why the initial segment? Why the initial segment, right? Why initial segment? A, is it because it has a low threshold potential? Or B, it has a high number of sodium channels per unit area. High number of sodium channels per unit. Why does the action potential arise in the initial segment? Is it going to be a low threshold potential or a high number of sodium channels? And the answer is high number of sodium channels per unit area. Please remember, threshold potential will remain at minus 55. But in these areas, axon hillock initial segment, it is easier to reach minus 55 because they have a high concentration of sodium channels per unit area. Now, my next question related to this topic is, which one has a highest concentration? Which part of the neuron has a highest concentration of sodium channels? Highest concentration of sodium channels per unit area. Which one has a highest concentration of sodium channels per unit area? Is it going to be the dendrites? Is it going to be dendrites? Is it going to be soma? Is it going to be axon hillock, initial segment? Is it going to be nodes of Ranvier? Or is it going to be the surface of myelin? Surface of myelin. Right? Surface of myelin. Please remember, highest concentration. Axon, hillock, and initial segment have a high concentration, but highest is present at the nodes of Ranvier. Nodes of Ranvier have got 2,000 to 12,000. 2,000 to 12,000 sodium channels per square micrometer. Per square micrometer, per square micron. That is 2,000 to 12,000 sodium channels per square micrometer. Least will be on the surface of myelin, which has got less than 25 channels per square micrometer. This is going to be the least number of sodium channels. At least number will be on the surface of myelin. Axon, hillock to an initial segment is about 350 to 500 sodium channels per unit area. But the nodes of Ranvier will be highest will be at the nodes of Ranvier. Axon, hillock and initial segment higher in the initial segment, but highest will be at the nodes of Ranvier. Right? Nodes of Ranvier. This is as far as your sodium channels are concerned. Maximum at the nodes of Ranvier, and this is about the least will be on the surface of myelin. Right? Now comes yet another question, and this says this in a sensory neuron. In the sensory neuron, site of generation of an action potential in a sensory neuron, what is the site of generation of action potential? A, is it going to be the initial segment, or B, is it going to be the initial or the first node of Ranvier? Now, in the case of the sensory neuron, it is the initial or the first node of Ranvier. Spinal motor neuron, initial segment. Sensory neuron, the first or the initial node of Ranvier. Right? Spinal motor neuron will be the initial segment. Initial or the first node of Ranvier will be the site of generation of action potential in a sensory neuron, right? So somebody wanted this to be arranged. This is surface of myelin, from maximum nodes of Ranvier, initial segment, axon hillock, soma, dendrites, least will be surface of myelin. From maximum to least, somebody was asking me, arrange them in an order. First is nodes of Ranvier, then initial segment, then axon hillock, then soma, then dendrites, least will be surface of myelin. Okay? All right. Now, I said in a sensory neuron, the site of generation of an action potential is going to be the first node of Ranvier. In a spinal motor neuron, it is going to be the initial segment. Now, let me just try and tell you why this difference in the spinal motor neuron and the sensory neuron, right? Sensory neuron, or what is known as why is there a difference in the site of generation? So let's try and see what is the difference between the two types of neurons, the motor neuron and the sensory neuron. Soma is cell body, dendrites are processes. Soma is cell body and dendrites are processes. Okay? Okay. Now, Srinivas, Mithun Mohan, please, I am explaining it. Have patience, I'm explaining. The next thing which I'm doing is that, your doubt. I know what are your doubts and I'm trying to explain that. Okay. Nikhila, sunlo. Nikhila, please listen. Right? Okay. Now, in a spinal motor neuron, what is the spinal motor neuron? This is also known as the A-alpha motor neuron. This is also known as the anterior horn cell. The spinal motor neuron is also known as A-alpha motor neuron, anterior horn cell. This is also known as the lower motor neuron. These are synonyms. Sensory neuron is known as the DRG cell. What is DRG cell? This is the dorsal root ganglion cell. Dorsal root ganglion cell. Right? DRG cell. Now, the spinal motor neuron, this is a multipolar neuron. Multipolar neuron. Whereas the sensory neuron is a pseudo-unipolar neuron. This is pseudo-unipolar. Now, what is a multipolar neuron? Spinal motor neuron, like I said, is a multipolar neuron. What is a multipolar neuron? Multipolar neuron means it has multiple processes. It has got dendrites. It has got an axon. So it is a multipolar neuron. Sensory neuron is pseudo-unipolar. That means this is the cell body. It appears it has got one process, but in fact it has got two. So it is pseudo-unipolar. Pseudo appears as though it has one process, but in fact it has two. Pseudo-unipolar. So one process goes towards the spinal cord and the other process goes towards the skin, towards the periphery, towards the skin. Because remember, sensory neurons have to carry impulses from the skin to the spinal cord. Okay? So motor neuron is multipolar, sensory neuron is pseudo-unipolar. Motor neuron, the cell body, this lies in the anterior horn of the spinal cord. This lies in the anterior horn of the spinal cord. Cell body lies in the anterior horn of the spinal cord. Pseudo-unipolar, the cell body lies in the dorsal root ganglion. It lies in the dorsal root ganglion. Yes, very basic difference. The cell body lies in the anterior horn of the spinal cord, gray matter, and cell body of the sensory neuron lies in the dorsal root ganglia, right? So what happens in the case of the spinal motor neuron? Spinal motor neuron, cell body lies in the anterior horn of the spinal cord. The process emerges from the spinal cord and goes towards the muscles. Now, what is controlling this? The spinal motor neuron, the major tract which controls the activity of the spinal motor neuron, this is the corticospinal or the pyramidal tract. Pyramidal tract, yes, the pyramidal tract which is the corticospinal tract, this pyramidal tract, this now excites it forms synapses with the dendrites and the cell body of the spinal motor neuron. It excites the spinal motor neuron. So what happens is, remember, the dendrites and the cell body do not have sufficient number of sodium channels. It is the initial segment which has got a sufficient number of sodium channels. So the action potential arises in the initial segment, cannot arise in the soma dendritic zone. Soma dendritic zone, you can only have local potentials. Sodium channels are insufficient. Initial segment has got sufficient number of sodium channels, and now this action potential jumps from node to node. Jumps from node to node, that is known as solitary conduction. So site of generation of an action potential in the case of a motor neuron is going to be the initial segment, right? Remember, the tract which controls the lower motor neuron is the corticospinal tract, excites the lower motor neuron, the cell body is in the spinal cord, axon emerges from the spinal cord and goes towards the muscles, neuromuscular junction, muscles. So action potential will arise at the initial segment, jump from node to node, which is known as solitary conduction, to go towards the muscles. Let us see what happens in the case of the sensory neuron. Now, sensory neuron, the organization is completely different. Now, the sensory neuron, if this is the spinal cord, the sensory neuron, it is a pseudo-unipolar neuron. When I say pseudo-unipolar neuron, this cell body lies in the dorsal root ganglia. There are two processes, one which goes towards the spinal cord and the other which goes towards the skin. So when I give a sensory stimulus on the skin, pain, touch, temperature, now what will happen is, the action potential will arise in the first node of Ranvier, which is closest to the receptor. When I give a painful stimulus, the pain receptor will be excited. Receptors are associated with nerve fibers. Action potential will arise in the first node of Ranvier. And this action potential will jump from node to go towards the spinal cord. Please remember the basic difference between motor neuron and a sensory neuron. Motor neuron is multipolar. It is carrying impulses away from the spinal cord towards the muscles. A sensory neuron is pseudo-unipolar. It is carrying impulses from the periphery to the spinal cord. Site of generation of an action potential in a spinal motor neuron, initial segment; in a sensory neuron, first node of Ranvier. First node of Ranvier means the node of Ranvier which is closest to the receptor. That becomes the first node of Ranvier for a sensory neuron. Okay? Has everybody got this concept? Okay? Okay. Can we move on? Yes. So this is the site of generation of an action potential. In a motor neuron, initial segment; in a sensory neuron will be the first node of Ranvier. Okay. This is as far as your. Okay. Next is So I can write this here, site of generation of action potential in a motor neuron. Site of generation of an action potential in a motor neuron is the initial segment. Site of generation of an action potential here is the initial or the first node of Ranvier. Chalo, let's go on to the next thing. Now, as far as the next thing is concerned, that is what do you understand? Next is what is the strength duration curve? Okay? Strength duration curve. Abhinav, good. I'm so happy. Spinothalamic tract, Sriraj Alapati, sensory, spinothalamic. Okay? First order sensory neuron is what we call the sensory neuron. Okay? All right. Achha, the order of, okay, let me try and see, where is it? Ye dekh. From maximum to least. Somebody said, order Akanksha, dekh lo beta. From maximum to least, I've given the order here. Single neuron, Anuj Jain, single neuron. We'll discuss this next time when we do CNS. Okay? All right. From dendrites to axon will be for motor. Have you understood? Okay. All right. Next, let's see. Let's go on to what I was trying to tell you. What is the strength duration curve? Strength duration curve. Now, what is the strength duration curve? Now, strength duration curve. Now, in the strength duration curve, we take the strength of stimulus on the y-axis. Strength of stimulus. Strength of stimulus. And what is the stimulus? Stimulus is an electric current. Strength of stimulus is on the y-axis, and the time taken for response. Time taken for response is on the x-axis. Right? Time taken for response. Strength duration curve. We take the strength of current on the y-axis, and time taken for response is on the x-axis. Right? Now, a very basic kind of information here. More the strength of current, less is the time taken for response. Yes? More the strength of current, less is the time taken for response. Less the strength of current, more will be the time taken for response. Okay? More will be the time taken for response. Last slide. क्या हो गया बेटा? कौन सा लास्ट स्लाइड आप लोगों का मिस हुआ? ये चलो देखो, ये वाला लास्ट स्लाइड, ये वाला चाहिए. ऋषभ, ललिता, प्रणेश, ये वाला है. ओके, ठीक है. See, R Santosh Ganpat, this is very interesting. See, how do the local potentials reach the action potential? He's trying to ask me this. You must understand that a single neuron of the corticospinal tract forms numerous junctions with the dendrites and soma of the spinal motor neuron. So there are a number of local potentials which are generated. We've discussed that. These get summated and you get an action potential. Have you understood? We've already discussed that. Darshika, you can't even believe how tired I am, but there is this is a goal-oriented class. We have certain goals in front of us. See, because everybody keeps saying this is going the slow reason, though we are not wasting any time here. The reason is you are thousands which are attending the class at the same time. I'm trying to cater to all of you and trying to address genuine doubts out of these thousands of messages which come in. right? So it is an extremely tiring thing for us, and not just for us, even for our families. Whoever is there at home, they're all sacrificing. They cannot access the net. They cannot make any noise. They can't go. I'm sitting on the dining table. Nobody can go to the kitchen and eat anything. So everybody's sacrificing with me. So the least I can expect from you is cooperate, isn't it? That is the least that we can do. We are knit together. And the reason why I'm not talking of fatigue here is we need to do this. We need to finish this so that you don't waste too much time. This is something which is, we are lucky that we are able to access this during lockdown. The whole world is shut down, but we are still continuing with our studies. So let's make the best use of it. If just the fact that we are able to have these classes fills me with so much pride, so much, it is so motivating for me. It is something which is, I feel absolutely privileged. I feel extremely lucky, and I'm sure that you feel the same thing, right? And we have to make the best use of it. So fatigue is something we are not going to talk about, right? So this is, okay. So let's go on to the next one. Yes, don't worry, pyramidal tract, spinal thalamic tract, we'll be doing all of this in detail the next time when I do CNS. Yes, I'm doing the basis of neurology with you right now, basics of neurology, and next time we are going to do CNS. Okay? Now let's have a look at the strength duration curve. So I said more the strength of stimulus, less is the time taken, less the strength of stimulus, more is the time taken. And when I see the graph, this is the kind of graph that we get. More the strength of current, less is the time taken, less the strength of current, more is the time taken for response. More the strength of current, less is the time taken, less the strength of current, more is the time taken for response. And we also know that below a certain strength of current, there is going to be no response. See, when I talk in terms of response here, I mean an action potential. This is action potential, right? This is as far as your, now there are 2-3 important terms here, and let's try and do which are these important terms. The first one is what you understand by Rio base, right? What is Rio base? Let's write this down. What is Rio base? Rio base is, what is Rio base? This is the minimum strength of current. Minimum strength of current, which when applied, minimum strength of current, which when applied for a prolonged and not defined period of time, for a prolonged and not defined period of time, right? What is Rio base? Rio base is minimum strength of current which when applied for a prolonged and not defined period of time. This is known as Rio base. What is Rio base? Minimum strength of current which when applied for a prolonged, not defined means it can be for milliseconds, it can be for seconds, it can be for minutes, but which just produces a response. Minimum strength of current, which when applied for a prolonged period of time, produces a response. Okay? Produces a response. This produces a response. This is known as produces a response. This is known as Rio base. Minimum strength of current which when applied for a prolonged or a not defined period of time produces a response. This is known as Rio base. Second important definition which has been asked as a question in your exam, and that is utilization time. What is utilization time? Utilization time is the time taken This is the time taken by a rheobase current. Time taken by a rheobase current to produce a response. Time taken by a rheobase current to produce a response. Right? That is known as utilization time. What is rheobase? Rheobase is the minimum strength of current which, when applied for a prolonged period of time, produces a response. What is utilization time? Utilization time is the time taken by a rheobase current. Time taken by a rheobase current to produce a response. That is known as the utilization time. This has been asked as an MCQ in your exam. What is utilization time? So if I see this on the graph, on the strength duration curve, the time taken by a rheobase current to produce a response is known as the utilization time. Time taken. What is rheobase? Minimum strength of current which, when applied for a prolonged period of time, produces a response. Time taken by a rheobase current is known as utilization time. The second is chronaxy. The third definition is chronaxy. Now, what is chronaxy? The definition of chronaxy. Now, chrona is also time. Chronaxy is the time taken. Chronaxy is the time taken by a current. Chronaxy is the time taken by a current which is twice the rheobase. Time taken by a current which is twice the rheobase is known as chronaxy, right? Chronaxy, yes. Utilization time is the time taken by a rheobase current. What is chronaxy? Time taken by a current which is twice the rheobase. That is known as chronaxy, right? Now, this is 2R current, twice rheobase. Time taken by a 2R current to produce a response is known as chronaxy. Time taken by a rheobase current to produce a response is utilization time. Time taken by a 2R current to produce a response is known as chronaxy. शिवानी, जब तक है जाम मत बोलो, आजकल के समय में मत बोलो. This is ठीक है. All right, chronaxy, time taken by a current which is twice the rheobase, right? Now, what is the significance of chronaxy? Lesser the chronaxy, more excitable the tissue, right? More excitable the tissue. Vijit, this is not math. Chronaxy cannot be 2 times the utilization or half the utilization time. Chronaxy will be lower than the utilization time, isn't it? It is not a linear relationship, isn't it? So it cannot be half. Okay? Now, lesser the chronaxy, more the excitability. Please remember, excitability is in terms of time taken for response. Okay? So this is your CP. Please see this. We are not talking of absolute refractory period here. What are we saying? We are discussing what is the relationship between strength of stimulus and the time taken for response. Stronger the current, lesser will be the time taken to produce an action potential. Weaker the current, more will be the time taken. That is what is your strength duration curve. Rheobase is the minimum strength of current, which when applied for a prolonged period of time produces a response. Utilization time, time taken by a rheobase current. Chronaxy is the time taken by a current, which is twice the rheobase. Yes? Lesser the chronaxy, more excitable the tissue. Please remember, again, this excitability here is not in terms of resting membrane potential. It is in terms of the time taken for response. Lesser the time taken, more excitable the tissue. Now, if you look at the chronaxy of a nerve is less than the chronaxy of a skeletal muscle, right? Chronaxy of a nerve, Sakshi, chronaxy is time taken by a current which is twice the rheobase. करंट को डबल करना है, टाइम टेकन बाय अ करंट विच इज ट्वाइस द रियो बेस. ठीक है, all experimental conditions we take the chronaxy. We don't take utilization time, we take the chronaxy. Chronaxy of a nerve is less than the chronaxy of the skeletal muscle. And nerve fibers are of three types. There is type A, there is type B, and type C. A is the largest diameter, B is small, and C is least. More the diameter, more will be the total number of sodium channels. Total number of sodium channels, lesser is the time taken for response. Lesser will be the time taken for response. So what will happen to the chronaxy? Chronaxy will now reduce. There will be a decrease in chronaxy. So in other words, what is the chronaxy of the type A fiber? This will be less than chronaxy of B, which is less than chronaxy of C. More the diameter, more the surface area, more the total number of sodium channels, lesser will be the time taken for response. Therefore, lesser will be the chronaxy. Type A fiber is less than, has a chronaxy which is less than type B, which is less than chronaxy of type C. In muscles, chronaxy of skeletal muscle is less than chronaxy of cardiac muscle, which is less than chronaxy of smooth muscle. Okay? Chronaxy of skeletal is less than chronaxy of cardiac, which is less than chronaxy of smooth muscle. Right? So this is what is the chronaxy. Now, what is the clinical importance of knowing this strength duration curve? What is the clinical importance? See, after a nerve injury, what will happen to the chronaxy of that particular nerve? There is an increase in the chronaxy of that nerve. There is an increase in the chronaxy of that nerve. But as the nerve regenerates, there is going to be a decrease in the chronaxy. There is a decrease in chronaxy. So after a nerve injury, if you are doing strength duration curves of that nerve at regular intervals and you get a decrease in chronaxy, that is a positive sign. Have you understood? This is the significance of knowing chronaxy. Right? Please remember, please see this once again. Look at the strength duration curve. When I say Rio base, what is Rio base? This is the minimum strength of current which, when applied for a prolonged period of time, produces a response, and the time taken by a Rio base current is utilization time. I double the current to twice the Rio base, and the time taken by a current which is twice the Rio base becomes chronaxy. Have you understood? So these utilization time and chronaxy are the time taken. Utilization time by a Rio base current, chronaxy by a current which is twice the Rio base. Significance, lesser the chronaxy, more excitable the tissue. Right? Now, out of a nerve and muscle, which one will have a lesser chronaxy? Nerve is obviously more responsive, more excitable as compared to muscle. So chronaxy of nerve is less than the chronaxy of skeletal muscle. Out of the nerve, there are three types of fibers, type A, type B, type C. Type A has got the largest diameter, maximum surface area, total number of sodium channels, lesser will be the time taken for response. So chronaxy of A, less than chronaxy of B, which is less than chronaxy of C. Muscles, chronaxy of skeletal muscle, less than chronaxy of cardiac, which is less than chronaxy of smooth. As the nerve regenerates, now what is the clinical importance? Like I said, after a nerve injury, the chronaxy of that nerve will increase. Time taken for response will increase. But as the nerve regenerates, there is a decrease in chronaxy. Right? There is a decrease in chronaxy. Type A, type B, type C are the types of nerve fibers. Yes? Chronaxy is maximum for smooth muscles. Absolutely right. Maximum for smooth muscle. Please again remember, Shriyanka, chronaxy is based on the time taken for response. That means smooth muscle has least number of cation channels on the surface. So it takes the maximum time to produce a response. Right? Nerve regenerates, chronaxy will decrease, isn't it? But once the nerve regeneration is complete, the chronaxy will be almost normal. isn't it? All right. Beta, these are lost self. That's a funny name that you've kept for yourself, right? Lost self. I hope you're not as lost now, and that is the after 12 hours of physiology. I hopefully you're not as lost, and that is what was your question? Sorry, I forgot. I got distracted by your name. कहाँ गया? Lost self. Got lost. किधर गया lost self? अरे, I can't see you anymore. Lost self. I've lost it actually. Where are you? Okay, I don't know what your question was. Sorry. Okay. Okay. Yes, a nerve does regenerate. Vijit Jain. Nerve does regenerate. Okay. Okay. All right. So this is as far as your strength duration curve is concerned. Okay. 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 Next, let's go on to what are the factors which affect the velocity of conduction? What are the factors which affect the velocity of conduction? Factors affecting velocity of conduction. Factors affecting velocity of conduction. Of a nerve impulse. Right? Factors affecting velocity of conduction in a nerve impulse. Please, somebody was asking me, least speed nahi hai. Strength duration curve is the time taken for response. The time taken for response is maximum in smooth muscle because smooth muscle has the least number of cation channels on the surface. Okay? Chalo. I think we've reached 9 o'clock. So you start this. Firstly, before we wind up, I'm winding up. Okay? Today is the first day. You've been sitting for 12 hours in front of the computer screen. I know this is, class is, I'm stopping the class here. But before we stop that, all of you have to give yourself a little appreciation. You sat for 12 hours, you concentrated for 12 hours, which is great, right? This is, we will definitely finish our physiology in 4 days. Today is just the first day. Next time, next Sunday, when I meet you at 9 a.m., I'll continue from here and also start CNS. This is part of CNS, in fact. This is basics of neurology that I'm doing with you. We've already, in fact, started some of CNS. Okay? All right. And good night and see you next Sunday at 9 a.m. Okay? Okay. God bless and bye. Oh, queries? All that. So for queries, you can any platform and I'll try and answer your doubts. Okay? Chalo. Okay, bye-bye and good night. Let me try and... the other. हेलो हाँ जी बंद कर दो